Hi guys, this is Viola Scott, the occupational therapist, and we have Michael Horsley, our certified vestibular physical therapist. And we are back today to talk about dizziness and balance as promised last week in our video. And we're going to talk about the three things that influence your balance, which is your eyes, your ankles and your legs, and your vestibular system. And Michael's going to talk about the vestibular system in a little bit more depth. So tell us a little bit more, Michael, about the vestibular system.
Okay. The vestibular system, it's deep inside your inner ear. Each ear has a vestibular system with it. The main job of the vestibular system is to detect when your head is changing positions, whether it's looking up and down, side to side, and let your brain know what's going on so that it can help you keep your balance. There's two main things that can go wrong with the vestibular system. The most common is called benign paroxysmal positional vertigo, or BPP for short, BPPV for short if you want to Google that. What that is in short is you have crystals in the vestibular system and they get in the wrong place. And when that happens, it causes you to have symptoms of vertigo, which is actual spinning sensation when you change positions. For instance, if you roll over in bed, get out of bed, either you'll feel yourself spinning or you'll feel like the room is spinning around you. This is very common and it's very treatable. I evaluate you and we do a treatment, and it generally takes 1 to 3 treatments to get rid of it 100%, and it generally stays gone after that. Another vestibular problem, it comes with aging most often, or some type of head trauma, but when you're walking, say in the grocery store, and you're looking left and right at the products on the shelves, it can cause you to feel dizzy and lose your balance. And that's a vestibular dysfunction that, once again, is very treatable. It generally takes about 8 to 12 treatments to improve, but it is very treatable. So generally when you come in for complaints of dizziness or balance problems, I do a full assessment of what it is that the problem is. If it's not related to the vestibular system, I'm able to tell you that and get you further assessment. But if it is a vestibular system, we can definitely treat it without a problem.
So you can, like, assess if it's related to maybe the blood pressure, if, when they're getting up and changing positions and your blood pressure drops, and that may cause you to feel dizzy or lose your balance. You can assess the difference between...
Absolutely, because that's another common complaint is, getting up quickly, people feel lightheaded. If you feel lightheaded, it's generally not your vestibular system. Generally has something to do with your blood pressure or medications. I think 90% of the medications out there claim to cause some type of dizziness as a side effect, and that'll give you a lightheaded sensation versus a vertigo and spinning sensation. So
okay. And like we spoke about earlier, your vision is to make sure you get that checked, because that also can affect your balance, especially at nighttime when you're getting up and your vision is not that great. That can influence your balance as well.
Yep, absolutely. You need to get it checked regularly. And then the third thing is your feet and legs. One common complaint, or not complaint, one common problem, especially as you age, is called peripheral neuropathy. The symptoms with that are that you get some numbness in your feet, and then people feel off balance when they close their eyes, when they're walking at nighttime and they can't see the ground very good. If they're walking on uneven surfaces, they feel off balance. So that's a problem with the input from your feet to your brain, and they're not working together. The best way to improve that is through strengthening your legs and your muscles in your legs. And another problem is just general weakness of the lower extremities. And again, it's strengthening of the lower extremities that you need to do. The most important muscles for the balance are your ankle muscles and your hip muscles. You got to keep them strong in order to help keep yourself upright.
And would range of motion also affect that if you have limited range of motion in your ankles?
Yes,
and
flexibility
knees?
issues of your hamstrings, of your ankle muscles. They're very dangerous for if you're having any other side issues, it can definitely have you falling pretty quick.
Okay, and that's a quick sum up of dizziness and balance, and we'll come back and talk about falls and fall preventions and tips on how to prevent falls in another video. But next week we're going to talk about assistive devices, which is like walkers and canes, and how to set that up, and that help with your mobility and prevention of falls. So thank you for listening, and we'll be back next week.